Good afternoon. Mahalo for joining today's Health and Human Services GM hearing on Monday, March 16th, 2026 at 1 p.m. There's somebody's thing here. We are convened in room 225. This meeting is being streamed live on YouTube. In the unlikely event that we must abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business later at 1:10 p.m. on Wednesday, March 18th, 2026 in room 225, and a public notice will be posted on the legislator's website. To facilitate this hearing in a timely manner, we will be enforcing a 1-minute limit on testimony, but not of those who are nominees. I will be reading a list of individuals who submitted written testimony for each measure. We apologize if the closed captioning does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislature's website. You'll find a link on the status page for the measure. We appreciate your understanding and remind you that the committee does have your testimony, that we review them, so I encourage you to use your time to either add additional comments or you can stand on your written testimony. Right after this, I will not be doing any more housekeeping announcement. We will go directly to the 1:10 p.m. bill calendar. So also present with me is my vice chair, Senator McKelvey. So first up, GM 541, submitting for consideration and confirmation to the Health Planning Council, West Oahu Sub-Area, gubernatorial nominee Christine Kabing Abang Tingkang. Come on up, Christine. Let us know what it is, why it is you want to be in the commission.
Okay, a little nervous. So,
Planning Council.
good afternoon, and thank you for having me and the opportunity to sit in front of you.
Could you
today.
put the mic closer to you?
Oh,
Thank
right.
you.
Okay, so good afternoon. Thank you for having me. Thank you, senators. So forgive my nervousness, but I would love to be a part of this advisory group just because of what things are happening here in the healthcare system. There's so many things that are uncertainties, right? Whether it be for our kupunas, our children, or even us as adults, and the ever-changing healthcare systems. And we have no idea what the next steps are. And I'll be, with the experience that I have, it would be great to be a part of the advisory group to see and mold a better healthcare system, and to be a part of this wonderful group with Dr. Lewin and Terry and the SHIPTA advisory. Their leadership has really started to pave the way with all these different programs coming on, like the AHEAD program, with CMS changes. I mean, there's so many things that I would be able to kind of have a path forward to be able to support our community.
Okay, thank you very much. Members, any questions for the nominee at this time? Okay, also in support of Christine's nomination, we have Dr. Lewin. Are you prepared?
I am.
Okay, State Health Planning and Development Agency in support.
Yes, thank you. We stand on our written testimony, but we're really happy to support Christine, Chair and Vice Chair, and I guess no member chair yet. She has already interacted with us in so many positive ways.
Good.
We've had interactions about the insurance world, of the medical payment side of things. And so she's been extremely helpful to us outside of this role in just keeping SHIPTA informed of what's going on in the market and the environment. She's very, very knowledgeable about what's happening in her space, and she has the respect of the community around her. So we think she's going to be a wonderful representative.
Thank you very much. Anybody else wishing to testify on GM 541? Members, any questions? So Christine, unlike the old SHIPTA, which is just concerned with certificates of need, you are aware from Terry and Dr. Lewin that it's a brand new world now with SHIPTA.
Yes.
They want to do far more things.
Exciting.
Are you ready for the challenge to
Absolutely.
help guide them?
Absolutely.
Okay, thank you very much and for being willing to volunteer.
Thank
Okay, next up, GM 554, consideration for Council on Mental Health nominee Danielle Bergen. Danielle, are you present? Danielle, is that you? Okay, please proceed. Let us know why you want to be in the State Council on Mental Health, Maui Service Area Board.
Thank you. I have been involved in my community in mental health, work training, and
Please identify yourself.
oh, I'm sorry. I'm Danielle Bergen, and I have been nominated to be on the State Council on Mental Health. And I was a former co-chair or chair, actually, of the Maui Area Service Board for the past 8 years and termed off of there, where I work to do my best for our community, our adults and our youth, for their mental health and mental wellness. I have been certified and trained to do several different kinds of mental wellness and suicide prevention trainings in my community, and have been doing so since 2017. In my past work with Mental Health America of Hawaii, was very much involved in the community and all the partnerships that are involved with it, like the Ho'okaika Partnership, the Maui Area Service Board, the Children's Community Council. And I think that volunteering is also a big part of this while I'm semi-retired and actually working as a consultant and a mental health trainer for Youthline Hawaii, which is new to Hawaii. That's the first call center in Hawaii for a peer-to-peer crisis helpline out of Portland, Oregon. And we're actually training our youth this week, our second class. So I'm just really committed to doing what I can for the community in light of everything that we've been through between COVID and especially the Lahaina side where I live and Senator McKelvey lives with the wildfires. And I just feel that being a positive force and doing what I can to help can help break the stigma and, you know, really try to open up people to realize that asking for help is a sign of strength and not weakness.
Okay, thank you very much. In support of Danielle Bergen's nomination, we have Department of Health. Is anyone here for Department of Health? Okay, none. Members, any questions? Okay, I see Department of Health. Please proceed. Identify yourself.
Yes. Good afternoon, Senator San Benaventura and Senator McKelvey. Yes, I'm standing here for the DOH, and we stand on our testimony, and we're really thankful that Danielle is stepping in.
Could you identify yourself?
Oh, this is Carolyn Wagan Hildebrand.
Okay, thank you.
I'm the planner. Mahalo.
Thank you very much. Anybody else wishing to testify on GM 554? Members, any questions?
No, but a comment. I know Danielle's work personally. She's done amazing work for mental health in our community, especially for the fires. So I'm just wanted to throw out the fact that I'm very happy and grateful that she's stepping up to join us in this. Thank you, Danielle.
Yes, and I also am impressed with your resume, Ms. Bergen, and thank you so much for being willing to volunteer. Okay.
Yes, thank you so much, Senators. Appreciate it.
So we're gonna, oh, by the way, for nominees, we will be doing the decision-making at the very end of the GMs. So, okay, next up, GM 555, State Council on Mental Health, Margaret Jackson. Margaret Jackson, are you present?
Not present on Zoom, Chair.
Not present on Zoom. Okay, next up, okay, we are gonna defer this to the end of the calendar, and if she shows up, otherwise we'll defer to the next hearing. Next up, GM 559, State Health Coordinating Council, Peter Sabinski. Peter Sabinski, come on up.
You're next on the Price is Right.
Senator.
Please identify yourself.
Okay, I'm Peter Sabinski, Senator Buenaventura and Senator McKelvey. Really appreciate the opportunity to be with you folks today. I think to answer your question very simply is I just believe in the value of public service and have been committed to it throughout my life. And unless good people get involved in public service, we get a less than good product. And I'm sure you've seen examples of both. I happen to be privileged to work for Governor Hawai'i and Jack Lewin in my role as a Deputy Director of Health and Director of Health. And I really feel that we did a great job improving the health of Hawaii. And it's a great opportunity to perhaps help out in an advisory capacity with Jack and with Governor Green to make health better in Hawaii and to take on this expanded role that SHPTA entails.
Okay, thank you very much. Okay, on behalf of GM 559, we have Dr. Lewin in support.
Chair San Buenaventura, Vice Chair McKelvey. I have to say that this guy and I have worked together so well for so many years, and it's a tremendous relationship. And so now I don't have to just call him up at home and ask him for what should we do about this and what should we do about that issue. We'll have him here on our highest advisory body. It's really important to have the perspective that Pete brings to this. But not only has he been a leader here in Hawaii, he led various other state entities and national association. So he's really a public health leader with state and national experience. And we're just so grateful to have his advice at this time with the Rural Health Transformation, the AHEAD grant, and all the other responsibilities that this entails.
Thank you.
Okay. Also, speaking on behalf of Dr. Lewin, we have Jennifer Diesman, HMSA, in support. And we have Marilyn Matsunaga also in support. Anybody else wishing to testify in GM 559?
Speaking on behalf of Dr. Lewin or the
On GM 559.
Dr. Savinsky.
Okay, thank you so much.
So
So,
we'll add this to comments from you.
so Dr. Savinsky, again, like all the other nominees, super well qualified. I see that you worked in Maryland, in Indianapolis, in DC, in San Francisco, as well as here in Honolulu. And I like the fact that you are with Hawaii Health Information Corporation, because that's one of the tasks that SHPTA is trying to get its handle on also, is our Hawaii Information Exchange. So thank you for being willing to volunteer and giving us your manao.
It'll be a pleasure.
Okay.
And just a point of personal interest,
Okay.
something I forgot. I wanted to let you know, Senator, as chair of HHS, that he was the father really of the SHIP program.
Oh,
And given all the issues we have with the uninsured right now, we really want to have all the expertise we can put together to think about how we can afford to cover people in these challenging
From the
times.
Tony Chang days.
Yeah.
It's like everything's old as new again, isn't it?
okay. Well, thank you. We need, like I said, this is a brand-new SHPTA. Okay, so we need all the expertise that we can get. Thank you so much. Okay, GM 561, moving on. Juvenile Justice State Advisory Council, Andrew Sabano. Andrew Sabano, are you present? Andrew?
Present, Chair.
Okay, so we'll defer this to the end of the calendar or to a time certain when he is available. Okay, next one would be GM 679, Board of Directors of the Hawaii Health Systems Corporation, Kelsey Liu. Kelsey Liu, are you present? Come on up. Okay, please identify yourself and let us know why it is you want to help HHSC.
Of course. Good afternoon. My name is Kelsey Liu, and I have had the pleasure of working with HHSC on the Oahu Region Board for the last in 2025. Initially, my influence and what made me really want to work with them is taking care of an elderly parent at home suffering from dementia and Alzheimer's, and it was like a perfect calling, I felt like, when I was asked to join Oahu Region, and it just felt very aligned. So when I was asked about the corporate board, it was a very easy yes, because I think that healthcare is going to change. It's ever changing. We are going to be faced with a scenario where you're going to have a lot of elderly that need help, and having good governance and oversight and see how can we make that happen is going to become even more important and critical as time in the next 5 years even.
Okay, thank you very much.
Of course.
Okay, on behalf of On behalf of GM, but, excuse me, 679, I'm getting old. We have Sean Sonata in support. Come on up.
Good afternoon, Chair, Vice Chair. Sean Sonata on behalf of the Oahu Region. Like Ms. Liu mentioned earlier, she is currently a member of the Oahu Region Board. She's been on the board since 2025, and she very rapidly demonstrated her aptitude for board governance. Her background in finance truly demonstrated her understanding of what our mission is and how she could apply her skill sets to, the mission that we're trying to accomplish, which is helping the most vulnerable population, of course, elderly primarily. When we were aware as a board of the vacancy in the corporate board, we felt that she'd be the perfect delegate, so to speak, representing what our mission is on the corporate level. And for those reasons, on behalf of the board, I was given permission to say this, that the board wholeheartedly supports her nomination and would respectfully request recommendation of confirmation.
Okay, thank you very much, Sean.
Thank you.
Okay, next up we have Ed Chu in support. Come on up for HHSC.
Good afternoon, Chair, Vice Chair, members of the committee. Edward Chu, President and CEO for HHSC. Besides the fact that she makes up for a lot of the shortcomings of the CEO of HHSC, we gladly support her and strongly support her consideration to be a member of the HHSC corporate board. I think her background in finance speaks well for itself. We have many significant financial challenges going forward into the future, particularly with the impacts of the federal, HR 1 bill, or whatever you want to call that dastardly thing. So I think her background will serve us well in that regard. And having worked with her on the Oahu Region Board for the past year or so, she asks a lot of good questions, and I think that's what we need as we move forward with our strategic planning for the future. So we stand on our testimony, strong support. Be happy to answer any questions.
Thank you very much. We also have Raul Magana in support. Anybody else wishing to testify on GM 679? Members, any questions? Okay, oh, good, we have quorum. Okay, I don't have questions. Sean Sonata and I know, I always task Oahu Region to become more self-sufficient, so your finance background, is a huge benefit to HHSC Oahu
We're
Region.
gonna need your help on a few things on Maui too, so I'm glad you're gonna.
Yeah, okay, thank you
I'm
very
reminded
much.
of that from the people behind you, so.
Thank you very much for your time.
Okay, thank you so much. Okay, next up, GM 705, Center for Nursing Advisory Board, Terilyn Luke. Terry, are you present?
Not
Okay.
present on Zoom, Chair.
Okay, oh, too bad. Yeah, it's a storm. Okay, we're gonna defer that to probably a time certain. GM 735, Tao Yan, for Board of Certification of Operating Personnel and Wastewater Treatment Plants. Tao Yan. Okay. Okay, so we're gonna defer that. Yes, you did note that, sorry. So for GM 735, 705, 561, and GM 555, we are gonna defer those hearings to Wednesday, March 18th.
Did you say 555?
That's what I got. I said GM 555, Margaret Jackson.
Correct.
Okay, GM 561, Andrew Sabano.
Correct.
GM 705, Terilyn Luke.
Correct.
And GM 735, Tao Yan.
Correct.
Okay, so for those GMs, we are going to defer their hearings to Wednesday, March 18th at 1 p.m. And at this time, we are ready for decision making. Are you ready?
I am, but we gotta just to make sure I got all that.
So next, we're going to go GM 541.
All right. Nice and easy here.
Christine Kabang Tinka. I thought my name was hard to pronounce. Okay, Christine. So Chair's recommendation is to advise and consent. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, 541 recommendation is to advise and consent, noting the presence of you and me and Senator Kanuha, with all others being excused. Any WRs and Os? Seeing none, recommendation has been adopted.
Thank you. Okay, for GM 554, Danielle Bergen, Chair's recommendation is to also advise and consent.
Wait.
Maui.
I don't have a 554 sheet here.
GM 554.
I don't have it, yeah, I'm missing that sheet.
Okay, what sheet do you have?
All I got is 541, 559, 679, and this one is, which one? No, that,
554, you got it?
yep, down, I got 554.
Okay, so for GM 554, Chair's recommendation is to advise and consent. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation 554 is advisory consent noting the presence of the members indicated before in EWRs and O's. Seeing none, recommendation is adopted.
Thank you very much. For GM 559, Peter Savinsky, Chair's recommendation is to advise and consent. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendations advise and consent noting the excused members earlier in EWRs and O's. Seeing none, recommendation is adopted.
So for GM 561, Andrew Sabano.
Okay, we'll
No, I'm sorry, that one is deferred. For GM 679, Kelsey Lu, Chair's recommendation is to advise and consent. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation on the GM is advise and consent noting the excused members earlier in EWRs and O's. Seeing none, recommendation adopted.
And with that, we are adjourned for our 1 o'clock calendar. Okay, we are adjourned. Let's take a short calling the 110 calendar, Health and Human Services. Same housekeeping announcement. This meeting's being streamed live on YouTube. Present with me is Senators McKelvey and Kanuha. Okay, first up, HB 816 relating to emergency response. First up, we have, excuse me. Went too fast. Okay, we have Dr. Lewin. In support? Okay, I guess he left. Next, we have Garrett Hall. Come on up. In support, test for Department of Health.
Good afternoon, Chair, Senator San Buenaventura, the Vice Chair and committee members. So the Department of Health stands in support of this initiative. However, we have substantial amendments to this, just to ensure that we comply with existing statute that's already in place. The way it was written, it would potentially allow any first responder to provide a medication, which that doesn't go. So we strongly support. We just ask that you adopt the amendments as placed into the recommendation.
Thank you very much.
Thank you.
And we have Dr. Lewin also in support.
Stand on our Chair, Vice Chair, and Senator Kanuha, we stand on our testimony in strong support of this measure.
Okay, we also have another Department of Health providing comments other than Dr. Hall, Aaron Hall. Next, we have Leland Brady, Aloha Independent Living Hawaii in support. Mark Gordon in support. Anybody else wishing to testify on HB 816? Members, any questions?
Quick question, Chair.
Okay, go ahead.
Dr. Lewin, super fast.
Yep.
I like the other bill better, Senate Bill 2505. If this committee were to go ahead and conform this measure to that measure, would you be supportive of that?
We'd
to
be
address the
supportive,
issues
absolutely.
raised? Thank you very much. Thank you,
And
Chair.
that was
That's it.
Mr. Hall's testimony.
Yep.
Got it. Just wanted to
Okay.
clarify that. Okay.
Yeah, thank you. Okay, next up, HB 1131, relating to intensive mobile team pilot program for houseless individuals suffering from serious brain disorders. First up, we have Dr. Lewin again in support.
Somebody didn't want their bill taken.
Thank you, Chair, Vice Chair, and Senator Kanuha. We think that it's obvious we really have a great need here, and we also want to defer to the Department of Health for the details of this. But this is such an important measure to help the safety of our citizens on the streets and for humanitarian purposes for the people involved. So we think this is a really positive way to solve this problem, in part anyway, and we strongly support it. Thank you.
Thank you very much. Next, we have Leland Brady, Aloha Independent Living Hawaii in support. Dr. Ignacio for Hawaii Medical Association in support Anybody else wishing to testify on HB 1131? Members, any questions? No. Okay, seeing none, moving on. HB 1562, relating to youth mental health. First up, we have Dr. Lewin in support.
Chair, Vice Chair, honorable member, we believe that we've seen this kind of program in action. We think this could be a very helpful, innovative way to approach youth mental health. And when, young folks have trouble expressing these kind of issues to other individuals, this is a way for them to be able to get these issues out and even then get self-referred to care and for treatment through this approach. We think it's really worth trying. It's working in other states. We'd love to see it happen here. Thank you.
Okay, thank you very much. Next, we have Bonnie Kahakui, State Procurement Office, providing comments. Chris Cofield, Hawaii Public Health Institute, in support. Come on up.
Aloha, Chair, Vice Chair, Majority Leader. I'm Chris Cofield from the Hawaii Public Health Institute. We're in support of this bill. The statistics make this clear. 1 in 3 students in grades 6 to 12 felt so sad or hopeless, as I'm sure you know, for 2 weeks in a row that they could barely function, yet less than 25% of them received appropriate care. And over 26% of students in grades 6 to 8 seriously considered suicide, yet only about 20% of those received appropriate or trauma-informed care. And we think this bill could be a tremendous help to those young people in need. Thank you so much.
Thank you very much. Okay, for 1562, we have Michael Galoyo Jr. in support, LGBTQ Commission. Michael Galoyo, are you present on Zoom?
Not present, Chair.
Okay, next we have Shelley Niles, Catholic Charities Hawaii, in support. Hawaii Substance Abuse Coalition, Alan Johnson, providing comments. Hawaii Community Foundation, Justina Acevedo Cross, in support. Leland Brady of Aloha Independent Living Hawaii, in support. Dr. Elizabeth Ann Ignacio, Hawaii Medical Association, in support. Judith Clark, in support. Judith, I see you. Please proceed.
I see you. Aloha, Chair, Vice Chair, members of the committee. As a community advocate and the former executive director of Hawaii Youth Services Network, I support this bill, which establishes a digital mental health platform
Judith,
for
could
youth.
you identify yourself on the record?
I'm sorry, I'm Judith Clark.
Okay,
I am
thank
a
you.
community advocate and the former executive director of Hawaii Youth Services Network. And I am testifying in strong support of this bill. In multiple years, young people who attend the Hawaii Children and Youth Summit at the state capitol have advocated for increased access to and increased funding for mental health services. They point out that many of the young people who need this help, especially in underserved rural areas, need supports to access services. Thank you for this opportunity to testify.
Okay, thank you very much. Okay, anybody else wishing to testify on HB 1562? Members, any questions? Okay, moving on. HB 1705, relating to child custody. We have no testimony on this. Anybody wishing to testify on HB 1705? Okay, seeing none, moving on. HB 2343, relating to veterans. Okay, first up, we have Department of Defense in support, Major Logan. Next, we have, come on in for Department of Defense. You don't look like Major Logan, but that's
No,
okay.
this is not. Chair, Vice Chair, Brigadier General Retired Nolan Tsuyoshi for Major General Logan. The department stands on its testimony and support. This is a very important bill for our department in order to move the state veterans home forward and to ensure its proper operation without any kind of delay. If there's any questions, we'll be here to answer them. Thank you.
Thank you very much. Next, we have Hawaii Office of Veteran Services, John Alamondine, in support. Sean Sanada, Oahu Region, HHSC, providing comments.
Good afternoon, Chair, Vice Chair. On behalf of the Oahu region, we're just comments, not because we don't support the facility. We absolutely support the facility. I know there were some issues regarding the control over the facility. For us, it frankly doesn't make a world of difference whether it's us or Maui, because we support Maui having an entity to do it. But if Oahu is necessary in order for the facility to move forward. We're there. You know, it's a
That's
purely
pretty much where it's
supportive position. We expect no remuneration or whatnot if we end up holding it in perpetuity. We seriously want to make sure the facility is established and with no benefit to Oahu. As long as it's there, it still supports our mission to support the vulnerable populations.
Ibawi. Thank you very much. Next, we have Hawaii Military Affairs Council in support, Michael Galoya Sr. in support, Thomas Driscoll in support.
Yes, Chair, Thomas Driscoll, Colonel, U.S. Army Medical Service Corps, retired, testifying as an individual. This is really an important bill for us. Strong support. We'd very much like to see this bill proceed through the entire process and give us this opportunity to work together. And that means together, all of us here today.
Yes.
It's a great team. Thank you for the opportunity to testify. I'm here if I have questions I could answer for you,
Yes.
please.
Okay, thank you very much. And thank you, Tommy, for always being here for this bill despite your retirement. Okay, anybody else? No, he championed it last session.
No, he's been there from all our
Okay.
veterans for years, so.
Thank you very much. So anybody else wishing to testify on HB 2343? Members, any questions? Are we ready for decision?
No, I would not.
Maui Senator?
No, this is a DM thing, not literally with the bills. Just before you quickly DM, I just noted something I wanted to ask you real quick.
Do you want to recess?
Yeah, can we do it for 1 second?
Okay, may we have a short recess? (110) HHS calendar for decision-making. For HB 816, Chair's recommendation is to insert the contents of SB 2505 SD1 into HB 816, make it upon approval, and any technical non-substantive amendments needed for clarity and consistency. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation on 816 HD1 is SD1, noting the presence of you and I and Senator Kanuha with all others being excused. Any WRs or no's? Seeing none, recommendation has been adopted.
So for HB 1131, Chair's recommendation is we need to pass this with amendments. We're going to need to, on page 4, line 5, update the report, change the appropriation dates to reflect the 2026 legislative session, and keep the defective date. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, pass with amendments.
Okay, recommendation 1131 HD1 is an SD1, noting the excused members earlier. Any WRs or no's? Seeing none, recommendation is adopted.
Okay, for HB 1562, we're going to accept the procurement office's proposed amendment, keep the blank appropriation, and keep the defective date. So pass with amendments. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, recommendation 1562 HD1 is an SD1 of the noting excused members. Any WRs or no's? Seeing none, recommendation adopted.
Okay, HB 1705, we note that there is a defective date. I like the contents of it, even though there's no testimony, but because of defective date, we're going to just keep it moving. So Chair's recommendation is to pass it as is with the defective date. Any comments? It already has a defective date.
Okay, so we're not redefecting it to create
No.
a Senate draft. Okay, straight to the gov's desk, right?
Yeah, okay, we're going to put in a new defective date of January 30th, 2050. I know, okay, pass with amendments on HB 1705. Yes.
Would you like the draft as it is?
No, we cannot pass it with the defective date because that has happened before.
Yeah, we don't want
And
another
we
Tara
ended up-
Purity
and we
task
ended up
force.
going to the governor's office with a
Yeah,
defective date,
yeah,
so we
yeah.
cannot do that.
We got to create an SD1 with our own
Yes.
effective date.
So
Okay.
any other comments, questions, concerns? Okay, pass with amendments, a new defective date.
Got it. Passing of the amendments to create a Senate Draft 1 on 1705 HD1 with noting the excused members previously. Any WRs or no's? Seeing none, recommendation is adopted, Chair.
Okay. So for HB 2343, we're going to pass this with amendments. We are going to change the defective date to be upon approval. Any comments, questions, concerns? Pass with amendments? Okay. Vice Chair for the vote.
Okay, for the vote, here we go. Recommendation on 2343 HD1 is a Senate Draft 1, noting the excused absences of Keokoholi and Favela. Are there any WRs or no's? Seeing none, recommendation has been adopted.
And with that, we are adjourned. Thank you, folks.